Continuing on, this is DVD number 2 for our fall staff meeting 2014. We are on number 8 at the bottom. Our HIPAA, Health Insurance and Portability Protection Act, that basically says it's a federal law where all of our clients' information is strictly confidential. The only way that we can release that information is if we are required to do so by law, or unless the patient either requests it to be done or consents for it to be done. Whenever you're discussing clients professionally, you want to only use their first name, especially if you're out in public and two employees meet out in public at a store somewhere and they want to discuss clients. You can do that, but you must keep their information confidential. This DVD will be a little bit shorter than the first one because we don't have as much content to cover. Moving on to the second page of the agenda, number 9, our holiday rotation, because some of the major holidays are coming up right now. As per our policy, employees are required to work every other holiday. Now we have Christmas and New Year's broken into 2 different holidays. We observe Christmas Eve as being a separate one. We observe Christmas Day as being a separate one. Same thing for New Year's. New Year's Eve is a separate one. New Year's Day is a separate one. The holiday rotation is as follows: Thanksgiving, Christmas Eve, Christmas Day, New Year's Eve, New Year's Day, and then would come Easter, Memorial Day, July 4th, and then Labor Day. One of the things that we cannot approve of is for employees to make a special request on the holiday. You can make it before the holiday, you can make it after the holiday, but you have to be part of the holiday rotation. What I would suggest is, if you know that you have worked Christmas Eve, make your plans for Christmas Day, because we're not going to schedule you both. If you work New Year's Day, then make your plans for New Year's Eve. That way that won't interfere with your schedule and it won't interfere with the patient's schedule. Number 10, our office hours that have to be went over with every employee on an annual basis. Our office hours are Monday through Friday, 8 a.m. to 4 p.m. We are available 24 hours a day. We do provide an on-call service in case you're in a home and there's a problem, in case you're sick and you're going to call off, or in case the patient has an issue and they need to get a hold of us. And remember, only call line 1, that's the 438-1936 line. And if you are at a home and there's an emergency that comes up, you ought to dial 911 first to handle the emergency, and then you want to contact our office after the emergency is taken care of. Number 11, our 2015 pay calendar. It is attached as well. And I apologize, I forgot to mention to you that there is an Ebola attachment. That's the first attachment there. And those are symptoms of Ebola that you should be looking for. I forgot about that attachment. And then we pay twice a month. All those dates are listed there. If the payday falls on a Saturday, then an employee would get paid on a Friday. If it falls on a Sunday, then the employee would get paid on a Monday. That hasn't changed. Number 12, our safety and our PI committee. We meet every month here in our Hopwood Uniontown office. We cover policies and policy review. We also cover any complaints that come in from patients or employees. And we're looking at things that are in clients' homes that are unsafe for either the patient or for the employee, and how those can be resolved and corrected so that it would be safe for us to go in there. Over the past year, we've handled several different unsafe situations, from no handrails on stairs to patients not with a wheelchair not having a ramp, to going into patients that have mean animals, to going into clients' homes where the animals are infested with fleas and having to have that, or roaches infestation. We've dealt with all of that over the past year. Having the family set up pest control services, even us ourselves going out and assisting with the pest control services. We're there to prevent falls, we're there to prevent fires, and we're there to prevent problems with patients' medications. Those are some other big safety areas that we cover. If you're ever interested in becoming part of the Safety and Performance Improvement Committee, we meet once a month. It takes us about an hour for the meeting. You get paid for the meeting while you're here. You would just have to let us know here at the office that you would be interested in that, and we could schedule that for you once a month. Next, number 13, before you leave today, this is how our company grows. We do not do advertising. Advertising is extremely expensive, and there is very to little to none results that come of it. It's really nice to see your name on television or in a newspaper, but just for one ad it could be $500 to $1,000, or even on the radio. We would rather take that money and give our employees gift cards, give our employees raises, because our reimbursement rates are so low from the state. We would rather spend that money on our employees than to spend it on advertising. So in order to supplement that, what we do is we hand out business cards in the public. If you're at a grocery store and there's an elderly person there, or at a post office, and you help them to their car or help them carry their groceries, give them a card and say, you know what, this is who we are, this is what we do. We help people stay at home so they don't have to go to nursing homes. And I hope you never need us, but if you know anyone that does, just have them give us a call. Our first year of business, I handed out 10,000 business cards myself. I still hand them out when I'm in public. I always keep at least 5 to 10 of them in my wallet at all times. And we're too big right now for me to just do that by myself. So I ask my employees to always have, 5 or 10 business cards on you when you're out in public. Hand them out. You could also hand them out to people that are looking for a job. And what I tell my employees is that won't affect you or your hours, because when we bring someone in new, they gradually build their hours up. You would have been here for a while. You have seniority. We're not going to take hours away from you to give them to a new person that's coming in the door. That's not our policy. That's not who we are. That's not what we do. So I need you to help me find competent employees in the areas in which you live. We'll also give you some pens so that you could either hand those out or take those with you to your clients' homes as well. Number 14, our AFLAC insurance that we provide. We're coming into the time right now in the fall before Christmas where you can actually sign up. I have the AFLAC for myself. All of the employees that have had AFLAC have benefited a great deal from it. It is a reimbursement type program. You may run into a medical problem, you go get it fixed, you pay for it, AFLAC reimbursed you. That's how that works, and it's very inexpensive. If you wanted to meet with our AFLAC representative, he could either come here to the office and meet you, he could come to your house and meet you, or he could meet you at one of the local restaurants. The next thing under 14 is the Affordable Care Act, which is now in place. There is an exchange, a federal exchange program. The laws have changed frequently over the last year that this has been going into effect. What you need to know is that you, as a citizen of the United States, are required to have health care insurance. If not, there will be penalties involved for anyone who does not have health care insurance, and I believe that'll take effect the end of next year. So coming into 2015, I would suggest that you either go to the Federal Healthcare Exchange.gov, healthcare.gov website, where you may qualify for some tax credits and cost-sharing reductions on health insurance, and that's based solely on your income. And then if you're able to get your health care insurance in place, that's going to prevent you from having to pay taxes or penalties at the end of next year. Number 15, our employee referral bonus. If you refer another employee to be employed here at Twin Oaks Home Care, and they work with us and you work with us for a six-month period of time, then you get a $100 bonus. That is your responsibility to track that. But all you have to do is refer someone to us. They put your name on the application. At the end of that 6 months, that's a way for us to say thank you for reaching out in the community and helping us to find employees, because it's not an easy thing to do. And I'm laughing because I just noticed that on my agenda, I've skipped number 16. I apologize. So instead of it being 17, the annual competency test, that should be number 16. So see there, we don't have 17 things to discuss, we only have 16. So the last thing we're going to do, and every year we do this, because when the Department of Health comes in, or QMET, which is the waiver surveyors, whenever they come in, they want to know the employees that we're sending out to clients' homes, are they competent to do their job? And the only way to do that, is to show them that you are competent, is for you to go ahead and take a test. So you've taken this test before at the end of your orientation class, and you're required to take this test on an annual basis. Again, if there's a problem or a question with the test, you're permitted to ask us. We will grade those. We will review any of the answers that you may have gotten wrong before you leave as well. That's part of who we are and what we do, to make sure that if you did get the wrong answer, that before you leave, you know what the right answer is supposed to be. And as far as that's everything that I have that's on the agenda. I appreciate your time. Employees are required to have so many hours a year of in-services and training. This will help suffice those requirements through the waiver program. Do well on your test. If you have any questions, don't hesitate to ask. And on behalf of Dawn and myself and the management here at the office, I just want to say thank you. We are a very important part of our community. We keep people out of nursing homes. Nursing homes in our area, other than the one that's up on the mountain in Henry Clay, are already full. They all have waiting lists that are maximum capacity. We, as a home care provider, we are full. We are at maximum capacity. And I think all the other providers in our area would say the same thing. Unfortunately, here we are, it's the tip of the iceberg. The baby boomers are now coming. They are now retiring. They now want to stay at home. They want to be independent. They're looking for our services. We're getting upwards of 10 to 12 phone calls a week. And the most we've had is 7 new patients in one day that we've picked up. And that was just 2 or 3 weeks ago. We have been actually swamped with new patients that need services. So I just want to say thank you. We are all working as a team to make sure that this takes place. You're in the home, you're doing your job, you're helping keep these patients out of nursing homes. We're doing our jobs here in the office with all the scheduling, the billing, the payroll. We are extremely busy. And my job, which I wear a lot of hats, I'm doing all the admissions right now. I don't have any other registered nurses that are helping me, because that cuts down on the costs, and that again allows us to give our employees raises and bonuses, because we believe that's very important in our day and age. So Dawn and I just want to say thank you for being part of the team. At any time we have an open door policy. If there's a problem that you can't bring to the office staff, you can certainly call in and talk to myself or talk to Dawn. If it's a problem dealing with an issue in a patient's home, I handle that. If it's a problem dealing with any of the payroll, scheduling, billing, then Dawn handles that. So in that way, you know exactly who to go to help you with those problems. 95 to 99% of the time, you're not even going to hear from me, and I'm not going to hear from you, because everything is going the way it's supposed to go in a client's home. And that's our goal. Our goal isn't to bother you. Our goal isn't for you to bother us every day. If things are running smoothly and correctly, which should be 90 to 95% of the time, then I'll be happy, you'll be happy, and our patients will be happy. So again, thank you for helping us, and we appreciate all that you do. Have a good day. Bye-bye.